Welcome to Lesson 5.1, How to Read Standard and Write Non-Standard Medical Notes. This is one of the most informative tutorials that we have in our program. And once you learn how to read standard and write non-standard medical notes, you will be able to see your healthcare through a more trained lens. Given the nature of this video, we recommend that you go through the video the first time all the way through. See how easy it is, and then go back to the parts that you need more information about. For this video, you will need a copy of Patient Better's S.O.A.P note template, a printout of the presentation notes, and your medical journal. In this video, we will explain how understanding and communicating medical notes in the S.O.A.P format is like having insurance for a productive office visit. So in order to achieve the best results for our learning, we will go through a brief examination on medical notes in the S.O.A.P format. We will learn how to use Patient Better's S.O.A.P note, and then we will learn how to write an entry in the medical journal. For easier learning, let's go through a couple of definitions. First, a medical note is a written or dictated document outlining the interaction the clinician has with you. The purpose of writing medical notes is to reduce the incidence of medical error by improving the accuracy, clarification, and coordination of the diagnoses and treatment. The S.O.A.P note is a standard document that clinicians create to report the encounter. We will go into this more in detail later on in the video, but for now, you need to know what a chief complaint is. A chief complaint is a brief statement precisely describing the medical issue or the reason for the encounter. For clarity, let's examine standard and non-standard medical notes. Going back to Lesson 4.1, we discussed how licensed health professionals write standard notes, while regular people without a license to practice medicine can write non-standard notes. In this video, we will apply the word S.O.A.P note as a broad term used to describe a medical note written in a particular format. In this case, the S.O.A.P format. In the S.O.A.P note, you will find that the S stands for subjective, which is the patient's chief complaint, or otherwise known as the CC. This is a very brief statement of the patient's purpose for the office visit. And the O stands for objective, which is the health provider's observation of you during the office visit. The A stands for assessment, which is the determination based on experience and knowledge of the diagnosis and the assessment of how you will best respond to their treatment. And the P in the S.O.A.P stands for the plan of the healthcare provider's intention of maintaining, recovering, or curing the diagnosis. Today, the S.O.A.P note has become the standard for health professionals to communicate. And this is how your provider constructs a S.O.A.P note through your encounter. Once you enter the treatment room, the medical assistant documents your vitals and your chief complaint. And then the provider will observe you in the objective section, and they will look for answers to the following 3 questions. How is my patient doing today? Are there any changes to my patient's health or well-being? And is my patient taking any new medications? And if so, what are the reasons why? And they will try to complete the subjective and the objective part of the encounter as quickly as possible, so that way they can better assess you. Their assessment is based on the experience and knowledge of the treatment and how you will best respond. And that will bring us to the last part of the encounter according to the S.O.A.P format, which is the care plan. And this may include lab work, imaging, physical therapy, or to go see a specialist for a second opinion. If you would like to put this video on pause and look this over, I have included an example medical note using the S.O.A.P note format. Now that we have uncovered how the S.O.A.P format fits into the encounter, let's take down those parts and group them into 2 phases. The first part of the encounter will be the discovery phase, where the provider gets to know you and why you are in their treatment room. And the last part of the encounter will be the treatment, where the professional provides a care plan and education to treat the diagnosis. Where the end goal of the encounter should be to minimize the discovery time while increasing the treatment time. For various reasons, you want to get as much information from your health professional that you can in the encounter. Now, before we go through our own SOAP note, let's learn exactly what a chief complaint is. Think of your chief complaint as the road that led you to the medical appointment. Here is the anatomy of a chief complaint and how it should be documented. First is the primary mention, which should be the title of the health issue, the location, where is the health issue located, the duration, for how long has the health issue lasted, the severity, how bad does the health issue hurt or irritate. Lastly is a secondary mention, which is the reporting of occurrence that may have provoked the health issue itself. And preparing your SOAP note prior to the appointment will be your key into reducing the discovery time and allowing more room for treatment. So let me walk you through in preparing a SOAP note. The front side of the SOAP note pertains to the subjective and objective, or the discovery phase of the encounter. And the back of the SOAP note pertains to the assessment and the plan, or the treatment phase of the encounter. The front of the SOAP note is sectioned off into 3 parts, which is the heading, the objective, and the subjective. If you can recall, the objective part is the observation that is taking place while in the treatment room. So go ahead and fill out those questions first. And the subjective is the chief complaint for the encounter. In our SOAP note, you can fill out up to 4 chief complaints. Today, we're going to fill out just 1 chief complaint. You'll get the hang of it from there. Filling out your chief complaint is so easy. In the primary mention, you need to write down what the issue or the concern is. You can liken the primary mention as a title. Put the date the health occurrence happened, where the health issue is located, the duration of the health issue, in other words, how long did this last, the severity of the health issue, and you can go ahead using a pain scale of 1 to 10, where 1 being the least painful and 10 being the most severe. Lastly, put the secondary mention, which is a possible trigger to the primary mention. And there you have it. That's how to create a chief complaint. The purpose of the back of the SOAP note is to help you or your caregiver self-record the account of the medical appointment. Often, your physician will have the documentation for you. However, in the instances where you would feel more comfortable doing it on your own, we have included the additional appointment guidance on the back of the SOAP note. Now, for the last section of this tutorial, we're going to go through journal entries. Journal entries are brief and concise records of occurrences. Journal entries are valuable subjective content that helps clinicians more quickly assess, determine objectives, and more accurately treat. It is important for all contributors to write journal entries in the same standard for readability. All entries must include the date and time the entry was wrote, the author's name, the title, and the event summary, as well as the date and time of the event. They must be as brief but accurate as possible, which could be just 1 sentence or a half a page if needed. To ensure accuracy, journal entries should be reported as close to the time of the event as possible and should not exceed 24 hours. And that concludes our video for today. Join me in our next lesson, 5.2, to learn how to treatment plan like an expert.